Good morning, everyone, and welcome once again to the highly rated Health Committee for the County of Renfrew. It is the appointed hour, 9:30. I'm going to call the meeting to order, and I will begin. As we gather this morning, I wish to acknowledge on behalf of committee and our community that we're meeting on traditional territory of the Algonquin Nation. We thank the Algonquin people and express our respect and support for their rich history. We are extremely grateful for their many and continuing displays of friendship. We also thank all the generations of people who have taken care of this land for millennia. With that, Ms. Hill, has the roll been called?
Yes, Mr. Chair, roll has been taken.
Thank you so much. I will note I received an email from Mayor LeMay, who will not be joining us this morning. I would invite now disclosure of pecuniary interest, and if so, the general nature thereof, please. I have to have my head on a swivel again now. I just don't have everybody right there in that, like, 11 inches. I see none. Thank you. Can I have the motion to adopt the minutes of the previous meeting held? I guess we're doing this in one resolution, Mr. Morrow, for both. Okay.
Thank you, Chair. Sir, the preference would be that we do two separate resolutions. Should there be amendment to one of them, then it can be dealt with separately.
Thank you. I am always searching for the ideal. Thank you very much, Mr. Morrow. That being the case, can I have a motion, please, to adopt the minutes of the regular Health Committee meeting held March 9th, 2022, please? Councillor Murphy, second. Councillor Bennett. Committee, any questions, comments, errors, omissions? Seeing none, all in favor? That is carried. Thank you. Now, I would invite a motion to adopt the minutes of the special meeting of the Health Committee held March 28th, 2022. Councillor Bennett, second by Councillor Grills. Once again, committee, any errors or omissions? Seeing none, all in favor? That is carried. Thank you. Just before we get into the departmental reports, I do very privileged this morning to introduce Ms. Tina Poplinski, who is the new Media Relations and Grants Coordinator for the County of Renfrew. Welcome on board after a very lengthy journalistic career with the Pembroke Observer, in excess of 20 years, as I understand. Certainly eminently prepared for the role that is about to befall. I think this, perhaps, we are just commencing day 3, so I'm sure you're right on top of the learning curve, Ms. Poplinski. Welcome on board. Thank you. With that, I would now turn it over to Chief Nolan to take us through the Emergency Services Department report. Please, Chief Nolan.
Great. Thank you, Mr. Chair. Through you to members of committee. It's my privilege to be in chambers with you here today and sharing a bit of what's going on within our program area. And I think the bulk of my report and as well Mr. Blackmore's is likely going to be related to the financial report that Mr. Foss is going to walk us through this morning. So I'll walk you through some of the operational items, and then if there are any questions following Mr. Foss's report to you, then I'm more than happy to answer those questions as well. Item number 1 related to the Community Paramedic Program update. We continue to onboard community paramedics within the program. As part of the orientation package, we've moved to a virtual orientation process. And in that process, we held a workshop on April 5th to 7th of this year. And just to give you an idea a little bit about what we fine-tune with the community paramedics, certainly an overview of the geriatric systems, older adult population, palliative care, as you know, is a significant issue for us here in the county, and the paramedics play a substantial role as part of the care team supporting palliative patients at home. Respiratory therapy, remote patient monitoring, patient assessment, documentation, and of course our medical directives. And a reminder that Dr. Christian Davis is our medical director for this program. And Dr. Davis, in his role, has provided a number of what we call standing orders or clinical practice guidelines that allow the paramedics to work autonomously, but also form a guide for consultation with other primary care physicians within the county. Item number 2 related to clinical assessment centers. This is an ongoing conversation with the province in terms of the evolution of the work, the very important work that we've been doing with the virtual triage and assessment centers. As you know, when we began this some few days into the pandemic, over 2 years ago, VTAC had played a critical bridge between the community and access to health services, principally assessment by primary care physicians, and then as well, of course, the paramedics and administrative staff have been working diligently doing their testing throughout the province in both mobile and in situ clinics. The province has been working really since the fall to provide clinical assessment centers, and so the addition to what we've been doing with the important work of VTAC is that we're also now doing physical assessments and patient histories to determine eligibility for antiviral medications. So this becomes the gateway that should you test positive through our new ID Now systems, which give us molecular test results within 15 minutes. That then becomes the start point for a conversation about your eligibility for antivirals, should you be in a risk category, should you be unvaccinated, and so on. So with these clinical assessment centers, we currently have one set up here at Shady Nook, as well in Arnprior at the Grove. We're onboarding a Cobden site shortly. So these are physical locations where patients will be sent for both ID Now testing and then subsequent evaluation for antivirals and full clinical assessments. And I think that this is a really important move because the VTAC physicians, through the VTAC system that we have set up for accessing primary care, also now become consultative physicians to the clinical assessment center. And I think that that's a very important next step in the evolution of both in-person and virtual care within the county. So you'll also likely remember that the clinical assessment centers and VTAC have also had renewed funding for this provincial fiscal year, which amounts to roughly $2.8 million for this year to continue the work of the clinical assessment centers and VTAC. That's happening in parallel to the important conversations we're having with the Minister and Ontario Health about the continuation of VTAC and the services that it provides, especially to our unattached patients here in the County of Renfrew. When we look at how this is evolving, we are continuing to provide 6 sites within the county. 3 of them will be the locations as previously described, which were also the previous locations for providing swabbing within the county. But we do also provide services in Deep River, Barry's Bay, and beyond. So we're in the process of evolving our footprint with both the clinical assessment centers in concert with the work of VTAC. And I think that that's just important that we understand that. So we are continuing to look for space. So if anybody has any space that they want to share, if you think about your own doctor's office, if you have that kind of space vacant in your community, or something that could be retrofitted to serve a similar purpose, it is staffed by paramedics and medical receptionists. So instead of being fully mobile, we're in situ, and we've got VTAC and those physicians in that consultation in a virtual capacity for the care that we're providing. So paramedics are now providing more care that would be akin to virtual care as we are moving this forward, but both primary care. So doing otolaryngoscopy, looking in your ears, not something that paramedics typically do as part of basic assessment. That is now forming all part of the basic assessment that they're doing as an extension of primary care to be able to work with the VTAC physicians to ensure that your care plan, your prescriptions, and your referrals are all happening in a timely and accurate way. Item number 3, Mr. Chair, related to the vaccine update. We do have an uptick, a significant uptick in the county for people receiving their 3rd dose booster recommendations. I'll not stand on the pulpit and remind people of the numbers that are going on within the province, but despite the fact that we've had shifts in terms of our precautionary measures within the province, certainly the wastewater data and the hospital data would start to suggest that we have had a significant increase over the past weeks, and what is expected to be an exponential increase in the coming weeks, moving into the Easter holiday. And so with that, there's a surge, if you will, of people seeking both 3rd and soon 4th dose vaccines. So we have ramped up our clinics again in concert with the Renfrew County District Health Unit to be able to make available vaccines to the public who are either a little late to the parade or those that are trying to get ahead of it with the fourth dose as they become available. Item number 4 is really a good news story and a reminder that our dispatchers, our telecommunicators, the 911 dispatchers that we have in the county, who work at the Central Ambulance Communications Center for both paramedic service and fire service through contract from the County of Renfrew, as well as, I think, of note, the 911 CERB dispatchers. So when you call 911 from the county, just a little reminder that that call gets routed to North Bay or another CERB within the province. They ask you police, fire, paramedics. From there, they downstream that to the local dispatchers, and those local dispatchers then expertly determine what your need is, align that with the closest available and most appropriate resource, and then send that out. And these people work tirelessly in the background. They do not get the credit that they deserve, and I think that this week is a good reminder of us to thank them for the excellent work that they do on behalf of both the County of Renfrew and also our residents. Despite the fact that the Central Ambulance Communication staff work for the province, they're every part as much of our team here in the county and are an invaluable resource and something that we need to protect. As you may know, the Ontario Provincial Police has closed down the Smiths Falls Dispatch Centre and has reallocated those resources throughout the province. We are very blessed to have the Central Ambulance Communication Centre at Renfrew available to us. And just a quick reminder and a thank you to them for the great work that they do. And item number 5, Mr. Chair, is the Treasurer's Report for December 2021. And I would leave that to you and Mr. Foss as to how you'd like to approach the review of that part of my report, whether it's now or later on. I'm not sure what agreement's been made.
Thank you, Chief. I think that what we will do, just prior to inviting Mr. Foss to take us through the report, maybe I'll review, as I sometimes refer to it, do the second lap on the information items, and then I'll invite Mr. Foss to have a kind of a dedicated conversation with respect to item number 5. That being the case, just bear with me one moment. Committee, going back to information item number 1, the Community Paramedic Program update. Any questions, comments? I see none. Item number 2, the Clinical Assessment Centers. Just one question, Chief. I'm wondering. I'm sure it is still happening because we are still seeing the official, I guess would be the way I'd put it, testing. So there is still PCR testing going on in the County of Renfrew, though it is enormously constrained. Who is doing or where is PCR testing being done, or do the paramedics still on occasion through VTAC do PCR testing as well?
Thank you, Mr. Chair. So the paramedics are conducting both the ID Now, which is the molecular 15-minute test, as well as the PCR test as required. Some institutions are requesting both. So actually right now with one of the hospitals that we're collaborating with, we are doing dual testing, both PCR testing, which gets sent off, and then within a few days we get the results, as well as the ID Now. And we're actually doing a comparison in terms of the efficacy and accuracy, or specificity and sensitivity of those tests. Recently, IRLA posted what the percentile levels of accuracy were based upon their research, and of course they're a private lab. So we're now doing our own testing, but suffice to say, the evidence would suggest that a rapid test comes in somewhere between 50 and 60% sensitive in its testing, where the ID Now comes in between 90 and 92, and the PCR test comes in at roughly 99%. So, of course, there are differences in terms of the duration of illness, as well as the severity of illness, and whether the person remains symptomatic or not at the time of testing. So, ID Now would represent the vast majority of testing that we're doing, but we will, based upon request, and as well as part of our evaluation, continue to do some PCR testing. But of course, as those, I think everybody here has probably experienced it by now, those tests can take days and days to come back, and I think that the immediacy and the efficacy of the ID now is really a sweet spot in terms of the determination of positivity versus negativity in a timely manner.
Thanks so much, Chief. Just as somewhat of a follow-up and perhaps also a lead into the next item, I'm somewhat flummoxed at why it is still taking a substantial amount of time for the PCR tests to turn around, since we're only doing about 20,000 a day now. At its height, just prior to the restriction on PCR testing that came about 2 weeks into the Omicron variant, where it was significantly reduced the eligibility for the PCR test, we were doing something like 60,000 a day. Now we're doing 20,000 a day, so I'm flummoxed at why it's still taking that kind of turnaround. Thrilled, actually, to hear that there is, because both of those testing, and presumably also the rapid antigen test, is still ongoing. Very pleased that there is it's not a clinical trial, so to speak, but certainly an analysis being conducted on the accuracy of the ID now versus the PCR, often referred to as the gold standard. The reason I was asking these numbers, and again, this is the segue perhaps into the next item, item number three, is COVID has never been more contagious than it is today, and it'll be more contagious tomorrow. I was somewhat, perhaps, taken aback when I saw comments that I had made, I believe, at the Health Committee last month, wherein I said, if you have not had COVID, you probably will in the next 6 weeks. Now, I'm absolutely prepared to stand behind those comments, because for the first 2 years of COVID, I don't think I knew anybody that had COVID, and now I don't have enough time to actually start writing down the list of the number of people that have COVID. By the way, if you're experiencing a cold right now, it's COVID. Just be sure that if you have a cold, if you have symptoms of a cold, you have COVID. Anyway, thank you for that. Very pleased to hear that. I will return now, committee, from my rant to the vaccine update. Item number 3. Oh, I'm sorry, Warden Robinson. I do have to get used to this once again.
That's all right. The chairs of the committees that met yesterday pretty well ignored me as well, so it's okay. I'll start knocking on my glass. How's that? It is about item
Always
number
innovative,
2.
Madam Warden.
Yes, I can be. I was listening to every word that Chief Nolan was saying when he was referring to the clinical assessment centers, and the evolution that I'm seeing here from VTAC into a clinical assessment center, and the potential it has to improve the lives of the people in the county of Renfrew and elsewhere. I'm very, very excited about it. I'm hoping that people, we need to get this message out that this is happening. When I hear about just the job descriptions now of our community paramedics and how they're evolving, and I have to tell you that it is so essential, because I'm not seeing a whole lot of new exciting things happening in our healthcare system. I've been a physician recruiter now for 4 years. I have never had such a dry period in my life. I've spoken to physicians in hospitals, and they're having a hard time just recruiting specialists, and it's like everyone is just, for some reason, staying put right now, and they're not looking at moving. So we're going to have to find a solution here. We can't hope and wait for an influx of other healthcare providers or family physicians. At this point, we have to take care of our own. So I'm very, very excited about it. Thank you.
Thank you very much, Warden Robinson. I see Councillor Emo with your hand up.
Thank you, Chair. And again, I was listening, but I guess I wasn't able to string things together as well as I should have. And to Chief Nolan, just to add a little bit to the warden's question, do you have criteria for these centers that you're hoping to set up in terms of space, and is it a long-term commitment? Is it a 6 months? Is it a year? Do you require release? Those kinds of things. If you could just offer me some clarity on that, please.
Chief Nolan, please.
Thank you, Mr. Chair, and through you to Councillor Emo. We do have criteria, and I'd be happy to share those with committee and all of council and the City of Pembroke in terms of space requirements, access, egress, and so on. One of the nuances related to the space is that we are intending to bring in known COVID positive patients into this space. So there is an adjacency requirement in terms of the sensitivity of people that are living within the same HVAC system, for example, and so on. So we want to be very conscious and cautious of that. But what this has the potential to represent is a whole new level of access to care for people within the county using VTAC as a triage system. And I think that's critically important. So I'd be happy to share the individual criteria. In terms of duration, like most things, we're on year-to-year funding right now with the province. But in conversations with senior members of Ontario Health, is that it is likely that clinical assessment centres will become the new norm in Ontario in terms of kind of an advanced point of access to care. Certainly COVID is issue du jour. However, every year we have seasonal influenza, we have respiratory outbreaks, and we have other things that easily consume the institutional care that we provide in Ontario. And my best estimate at this point is that the clinical assessment centres will be working as a forward guard to the system. And while our community assessment centres are modeled after the success that we've had with VTAC, VTAC itself needs to continue, but will continue in support of the clinical assessment centres and vice versa. When we think about how they are operating in other areas, some of them are staffed with nurses and physicians. In our case, they're staffed with community paramedics, with the virtual access to VTAC as part of that. So our footprint may be different than in other areas, but as it continues to evolve, we'll need to think about what those space requirements are and hopefully be able to build in some capacity on the front end. So an example for you in that is in Bell's Corners in Ottawa West. The Queensway Carleton's Clinical Assessment Centre has an X-ray machine in it. Our clinical assessment centres have point-of-care testing and ultrasound at them. So we'll need to think about all of the uses so that the clinical assessment centre can continue to evolve truly as an urgent care point of access. And one of the challenges, of course, we have in the county, given our geographic footprint, is we could put one somewhere in the middle, but that means that people from Head Clara-Mariah to Greater Madawaska to Barry's Bay may be driving an hour or 2 hours to be able to access that location. We've taken a distributed model, so more like a pop-up shop, if you will. So in the case of Cobden, Whitewater Bromley is extending an option for us to be working out of their facility at that location. We're going to trial it for the balance of this year. Currently we're at Shady Nook operating because it became the legacy of the swabbing that we've been doing and the vaccinating we've been doing at that location. We are looking for either some more confirmed site within that location or other locations within the community. An example, I think, as well might be the Mattaway Centre, where we've been doing some work in Renfrew. We need to look at what those options may be across our communities and model them, if you will, more like what your doctor's office would look like than an open gymnasium that doesn't have any privacy or our ability to do physical assessments and so on. Anyway, I hope that paints a bit of a picture, but I'll be happy to share the detail with you in terms of the footprint and the utilities required.
Follow-up, Councillor Emo?
Thank you. So to my uneducated ear, it sounds like, we may be trending towards like a virtual family health team in terms of being able to access VTAC and then hopefully grow that VTAC system to add on ancillary specialties.
I think if I could, Mr. Chair.
Please.
And perhaps the warden wants to speak to this, because I think, really what we're doing is we're building on the warden and council's vision here of what VTAC started as and what it became. And now as we look at clinical assessment centers, they are not to subsume VTAC. VTAC needs to be the title organization that now provides different levels of access to care within the community. And I think that that's important when we think about it as a triage option within the layers of VTAC's services. So when we think about how VTAC becomes both the starting point and the end point in terms of continuity of care, the instrument of care for some patients needs to be in person. We can't do a pap smear, for example, over the phone, but we can do a lot of things for a lot of patients virtually. But when we get down to needing to put ears on, you'll recall that the community paramedics would be dispatched to those patients' homes to do that full clinical assessment and then be able to do a consultative bridge to the VTAC physician and the patient to establish a care plan. What the province is looking for with the clinical assessment centers is some bricks and mortar, with an acknowledgement that really we're taking a light bricks and mortar approach so that we can have multiple sites throughout the county and continue to provide a distributed model. You heard my objection to adopting a Brewer Arena type model within the county from the beginning of the pandemic, and I think it's equally unacceptable today to ask everybody in the county to drive to one location for this type of care, knowing that the majority of people that will require this level of hands-on care are those people that are likely the least appropriate to be asking to drive for hours within the county. They're older patients with complex chronic disease. They're people that are immunocompromised. These are people that we want to be just around the corner if we can't be in your own living room. And that's why we're adding in this layer, and we're going to evaluate it, and we're going to evergreen it and mature it as we learn from it. Because we don't expect it to be perfect at the beginning or perfect at the end. We need progress, and we need to be able to ensure that everybody in the county has equitable access to care as close to home as we can provide it.
Thank you so much, Chief Nolan.
Thank you.
Councillor Murphy.
Thank you, Mr. Chair. My brain is percolating on this. I think it's a really exciting opportunity to get yet another level of care in some of our smaller communities. And if you didn't require, as Councillor Emo said, a static lease, or if you were able to do 1 day a week here or there, I think that if you could send us the criteria, that would be extremely helpful to get it out to, in my case, a few different places in my community that would probably have ample space for you. But I think that this is just excellent, and the evolution is wonderful. Did you say that you mentioned Dr. Davis is your primary physician, but is that only as almost like a proctor for the paramedics?
Chief Nolan.
Thank you, Mr. Chair, and through you to Councillor Murphy. I'll deal with the last first. So the role of Dr. Davis is that he's been under contract to the county for a number of years to provide medical consultation to paramedics where a patient does not have a primary care physician. As well, he's provided administrative support to the paramedics under the requirements of the College of Physicians and Surgeons of Ontario. So sometimes we need a delegating physician to be able to do a prescription renewal, for example. And in other circumstances, there are things that paramedics do on a day-to-day basis that are delegated medical acts, but don't require the day-to-day supervision or day-to-day involvement of Dr. Davis, because he has created standing orders, if you will. So, when the patient needs this, here's what I want you to do. And then that checks all the boxes from a medical legal requirement and a risk management requirement. So by having a named physician, this is different than a family doctor. He's not their family doctor, but to phone in a prescription renewal for your, blood thinner, instead of us shopping around for a physician, we have the ability to work very closely with Dr. Davis. So that's invaluable. Think of him as retainer to us for this purpose. And this is also 100% funded through the Community Paramedic and Long-Term Care Program. And I think that that's important information for you as well. So we have a memorandum of understanding and a contract with Dr. Davis. Our preference is always to work with your own family physician, because if they are the ones who initiated care for a particular disease, they are the ones who should be able to maintain continuity of that care. So let's say your physician prescribed you Lasix because your ankles get puffy and your heart's not doing so hot, and you get sick while that's happening. Sometimes we need to increase the dose of that medication as an episodic care requirement. We also now use VTAC as part of that process. So our first choice is to work with your family doctor, if you have one, so that they can maintain line of sight and continuity of care. And in some cases, they're very satisfied by the paramedics identifying a problem, creating a care plan, doing a consultation to adjust the care plan as a result of the situation, and then they'll make an appointment for that patient to go in and see them in a few weeks, right? Because something's changed and they want to put eyes on. And that is ideally how the system would work. The reality is that 25,000 or so people within Renfrew County don't have a family doctor. And some of the people that do don't necessarily have access to that family doctor in a way that would assist the community paramedics in keeping them from having to go to the emergency department. So it's a safety net. His role is to support the safety net, to legitimize the practice of the paramedics, but also from a College of Physicians and Surgeons requirement. We're very detailed in terms of how we meet all of those expectations. And of critical importance, VTAC backstops this entire program. So where we need to have further care, VTAC and its physicians also support the community paramedics. And where we identify patients who are orphaned and don't have a primary care physician, patients who do not have a primary care physician, we then refer them to VTAC and encourage them to use VTAC as part of their own care options as we go forward. And you know, the not so funny irony in all of this is the people who should have a family physician in Renfrew County are the least likely to have a family physician, because many of them have been orphaned by the retirement of their own family physician. So those are people with advanced age, complex chronic disease, and are right on that bubble where we don't want them to be orphaned. That's when they get orphaned in their care. And that's why VTAC is critically important, the role of the community paramedics, and the support of Dr. Davis in kind of the care and feeding of the team, both from a knowledge and education requirement, but also from a delegation perspective.
Thank you, Chief Nolan. Anything further? It dawned on me as you were explaining some of the multiple threads on that, and I've mentioned this before. I don't know if it was by design. If it was, you were incredibly prescient, but what you're describing seems like the natural evolution of both the HealthLinks program and the community-based efforts, initiatives that predated COVID, that it is now simply a cohesive whole and fully funded by the appropriate Ministry of Health for these services. So I think some of the foundational blocks certainly were laid a number of years ago, and then what we're seeing now is the natural evolution of so much of those efforts. Okay, thank you. Moving on then to item number 3, the vaccine update. Item 4, the National Public Safety Telecommunicators Week. I certainly want to echo Chief Nolan's remarks. Probably the unsung element, or largely unsung element, in certainly in the emergency health care provided through the paramedic services, indispensable. This is the bridge between the professionals actually being on site and those interminable, each minute when one phone's emergency responders translates into 10 for the one that's making the phone call. And these are those voices, these are those communicators that are able to provide reassurance to those that are calling in, but also to provide that incredibly valuable and concise information to those who are responding. So enormous shout out to those in the Central Ambulance Communication Center and all that they do towards the health and well-being of our community. With that then, thank you, Chief Nolan. I am going to delegate to Mr. Foss now. If you could take us through the Treasurer's report, please.
Thank you, Chair, and good morning, members of the Health Committee. You do have a copy of the Paramedic Services financial statements in your package as at December the 31st of 2021. I'll start with the department, if you will. We refer to it, or I refer to it here as the 911 program or the base program. You'll see that we have a municipal expenditure, a County of Renfrew expenditure of $11,052,000 against a budget of $8,308,000. That is $2.743 million over budget. In addition to that, I just want to draw your attention to the bottom of the page where, of course, we do have a municipal partner, the City of Pembroke, with a cost-sharing agreement based on population. And so the City of Pembroke's share of operating the base 911 program also increased by $394,000. So in total, we are $3,137,000 above budget. Last month, I did bring to this committee's attention and all of County Council that once every 3 years we're required to conduct a third-party independent actuarial review of our WSIB liabilities. And so we had significant changes with respect to the paramedic service and our paramedic employees. And because of that, this particular program, we had to record an entry to increase our expenditures and the offsetting liability by $2,740,000. And so of that $3.1 million in total municipal over budget, $2.7 million is directly related to the entry we had to book at the end of the year. So the program itself was roughly $400,000 over budget, exclusive of the WSIB adjustment. I will draw your attention, it's a long financial statement, so in the revenue section, 3/4 of the way down the statement, you do see that there is a account entitled Revenue Provincial One-Time COVID, $629,000 in this department was revenue that we recorded to offset direct expenditures of $432,000 and another about $196,000 worth of salary and benefit costs related to COVID. And so you may recall that we've set up a tracking system where we identify any sick costs or regular upstaffing costs or overtime costs that are directly related to COVID, and we track that within the payroll system with the different earnings code. And so there was about $200,000 worth of salary and benefit costs related to COVID that we offset by this provincial revenue. This committee may recall that early in 2021, which was we were very thankful to receive the notice early in 2021, we did have $1,009,000 that was sent to us by the Ministry of Health to our paramedic program to offset all COVID incremental costs. In addition to that, in February of 2022, we received a second letter with additional funding of $1,514,000 for our paramedic service to be used to offset all COVID-related costs. So in this program, we did use $629,000 of that original funding. In addition to that, we have used the balance of that first tranche and $469,000 of that second $1.5 million, and we use that to offset the VTAC and the vaccine program, and we'll talk to those about those as we move down in the financial statements. Just below the COVID funding line, you'll see provincial subsidy The actual provincial subsidy for paramedic services came in at $9,050,000, and our budget was $9,047,000. So essentially, we received all of the money that we anticipated. This committee will recall that the province does not cost share on an actual cost basis. Their share of their 50-50 share of running the paramedic program. In fact, we use an council-approved budget from prior years, and it is that prior year budget that they use to cash flow us funding for this current fiscal period. So we are, this provincial subsidy has no relationship whatsoever to the actual costs that are expended in the fiscal period. It is all to do with a previous council-approved budget. Moving on just to the next group of departments, you'll see that those departments have a, we call them paramedic other, but they have a collective budget cost to the County of Renfrew of $0, and we're reflecting a cost of $126,000. That is directly related to the long-term care program. We are booking revenues of $2.8 million. That program receives $2 million a year, and we received a three-year funding agreement by the province. So for the period of April the 1st to December the 31st, we used all of the $2 million that was allocated to us in this fiscal period. In addition, we used $800,000 of the previous fiscal funding envelope in the January to March period. So $2.8 million came in, and we used that to offset salaries of $2.2 million, salaries and benefits of $2.2 million, as well as other long-term care expenses. I do want to highlight for this committee that, of course, the $2 million annual funding time frame stretches from April of 2021 till March of 2022. So we are going to face some very significant fiscal challenges related to community paramedic long-term care program. For the first 3 months of the year, we essentially have no funding to operate on, and we are expending funds at a fairly significant level. So in your first quarterly financial statement that this committee sees for the 2022 period, there will be some significant financial pressures highlighted with respect to the long-term care program. Next to that, on long-term care, we have the VTAC program. We have an agreement with Arm Prairie Regional Health where we are billing them on a monthly basis for that service, and of course, Arm Prairie Regional Health receives their funding from the province of Ontario, but we reflect this as revenue from another agency because that is the source of our revenue. Arm Prairie Regional Health would show provincial subsidy coming to them and then transferring that money to us. So we have maximized our agreement with bill invoicing to them at $1,191,000. That was not sufficient to cover all of the costs in the VTAC program in 2021, so we had to use $268,000 of COVID funding to balance the program out. So this particular program was created to mitigate COVID-related activities in Renfrew County, so we are entitled to use some of that provincial COVID subsidy in order to offset the costs in this program. Below that, we have VTAC admin, and you'll see that we had $236,000 of salary and benefits and another $16,000 worth of expenses. We took over this program from Arm Prairie Regional Health September the 1st of 2021. We have an agreement where we are billing Arm Prairie Regional Health for this VTAC admin. These are our medical receptionists that answer the phone when you call the VTAC 1-800 line. Below that, we have, I'm going to call it our original community paramedic program. That's been ongoing for quite a number of years. That program received, we have budgeted at $330,000, and in 2021 we received a one-time top-up payment of $50,033 to enhance the service, and we used all of that funding to support our base community paramedic program. And finally, the vaccine program, salaries and benefits of $564,000, expenses of $16,000, and we used our COVID funding to offset those costs in the COVID vaccine program. And finally, the statement at the bottom of the page under emergency management. This is our agreement that we have with the Central Emergency Reporting Bureau, CERB, for our 911 program, so they answer our calls. That's $50,000 per year. In addition, we are under budget in the emergency management line item by $23,000, and although we had a budget of $50,000 for purchase services, we spent no dollars in 2021, so overall $85,000 under budget in this particular line item. And Chair, perhaps I would stop there and certainly attempt to answer any questions the committee may have.
Thank you very much, Mr. Foss. Very comprehensive review. Now, committee, I would invite any questions or comments on the Treasurer's report with respect to the paramedic services. Well done, Mr. Foss. I have, these never escape without me having something. With respect to the charge that must be taken with respect to WSIB, is that kind of contained the employee benefits about halfway down under paramedic employee benefits? It's 82, just over 82.5% over budget, and is that essentially where we are booking those substantially increased WSIB charge?
And thank you, Chair, and through you to you. That is correct. We booked it, an adjustment of $2,740,109 in that line item, directly related to our actuarial assessment at December the 31st.
Thank you. Final question, and I cannot recall whether this was at the February or March Health Committee, where there was a very late-breaking eligibility for, it was, I think, referred to as special COVID funding for emergency services, something on the order of just north of $1.5 million. Of course, this was while a great deal of the year-end information was being tied up, as well as substantial workload for the paramedic services. So I know that there was going to be some challenge, perhaps. Have we, but this did apply, as I understood, to the year now past, which even from a provincial perspective ended as of March 31st. Have we been able to find home for some, all of those, and if so, is that contained within this report?
And thank you, Chair. So yeah, there were two allocations of COVID-related subsidy that we were made aware of. In March of 2021, $1,009,837 came to us. We used $629,000 in the 911 program, and the balance we used in the VTAC support and vaccine program. But as you mentioned, in February of 2022, quite surprisingly, we received a letter with a second funding allocation for paramedic services for COVID mitigation. That was I keep getting emails popping up and it's blocking my notes. So that second payment was $1,514,402. We were able to use $469,485. So we could not use $1 million of that second payment. It was specific to the 2021 fiscal period with no carryover allowances, and so the balance we have to set up as a payable back to the province of Ontario.
Thank you very much. I'm certainly enormously appreciative of the province for that funding. Certainly, I think that there is this, I think, genetic displeasure, almost induces nausea when money has to be sent back amongst municipal politicians, likely amongst municipal staff. However, I think that it is also reflective of the province partnering with us significantly in the municipal sector in addressing COVID needs on an ongoing basis. So we certainly have had numerous envelopes of funding have flowed, COVID-related. So thank you both, Mr. Foss, to you and to Chief Nolan, and I'm sure to staff at a very busy time of the year to be able to make use of that very substantial installment. Anything further on the Treasurer's report? Madam Morton, you are in fact using your new communication system.
I am. Thank you very much, Chair. Through you, I don't know whether it's Mr. Foss or Chief Nolan. So it was mentioned that we are going to have a financial challenge because of the long-term care community paramedic program. And I remember with great joy being in Renfrew when we announced the program was starting, and it was 100% funded by the province of Ontario. So I'm going to make the assumption is that if we running out of money from the province, it's because the program has been so successful, and there's very many people out there that are hopefully receiving support from community paramedic program, which is enabling them to stay home, to stay off a wait list and stay out of long-term care. I'm just wondering, and again, you know, Chair, you're talking about the distaste, I guess, in having to send money back to the province when we really do need it here for other things, whether or not the increase in the uptake of community paramedics long-term care could be COVID-related. Just suggesting.
Chief Nolan, I believe that may have been directed to.
Sure, I'll take a poke at it, Mr. Chair. So through you to the warden. I love the way you're thinking. I think the challenge that Jeff and I have found ourselves in is that we're now working between ministries in the services that we're providing. And from a capacity perspective, certainly those paramedics the community paramedic funding from long-term care is to first go to care for those patients that are on the wait list or eligibility for long-term care. Now, we have had multiple discussions, and there's been an acknowledgement that they are also a surge capacity to be able to support COVID-related activities. Now, I would submit to you that that's not swabbing, the general public, or that's not vaccinating the general public, but we certainly have been supporting the patients that are on that wait list in different ways. So I think at first blush, in terms of the allocation of the funding, I believe Mr. Foss has very much appropriately put it in those locations. I am in discussion, wearing another hat as the Vice President of the Ontario Association of Paramedic Chiefs, talking to the ministry about the amount of funding that's being returned to them, because their criteria for eligibility was so narrow in terms of the application. And then secondly, to find out that we're getting that money after that year is incredibly problematic for us. Because of course we're not going to bend or break any rules related to the funding eligibility, but neither the eligibility rules or the timing of the announcement for that left us very much flat-footed in terms of our ability to have flexibility in moving that around. So I would submit to you, I think, given the books are closed for that year, I think we've done the best that we can within the rules and the timeframes we've been given. But that does not mean that the conversation is over with the province, because they will now have what is a federal surplus of COVID-related funding, right? That money was effectively flow-through funding from the federal government that did not have the same purse strings attached to it to the province, that the province then applied to our eligibility for expense. Jeff, would you agree or disagree with that?
Mr. Foss.
And thank you, Chair, and through you to committee. That is our challenge. The funding that we received, that we are returning, that came in February. So after the year end was over, and it was, as I mentioned to committee, it was quite surprising that we received the funding. It was not known to us. We didn't expect this. Thankful that it came, because we had to utilize $400,000 of this funding, and so it was needed to mitigate COVID expenses. But to date, in all of our COVID-related programs, and I will be updating Finance Committee tomorrow. We spent over $9.3 million in total COVID mitigation activities across the corporation, so not just paramedic services. All of those funding programs are very clear. The eligibility guidelines for us to spend money must be incremental costs that are incurred as a direct result of COVID prevention or mitigation strategies. And so we are not entitled, under the current rules, to be able to take that funding and slide that funding over to support another program, which in this case would be, we're talking about our long-term care community paramedic program, unless we can identify that some of those costs are directly related to COVID mitigation or prevention activities. So as Mike mentioned to you, the current rules around the use of that funding restrict us in what we can do. We can only set this up as a payable to return the funds back to the province of Ontario until some other direction is received or some allowance is given to be able to use some of that funding to support our other programs. As I mentioned, long-term care paramedic services for the first 3 months of 2022 will create a significant financial challenge for us. We are booking $126,000 of municipal expense related to paramedic long-term care in 2021. So it's not 100% funded by the province. It's now being funded by the ratepayers of Renfrew County, and that situation will also exist in 2022 unless we have some other support or are allowed to spend some of our COVID funding to support that particular program. Thank you.
Thank you, Mr. Foss. Just picking up on Chief Nolan's comments. First, I'll commend both Mr. Foss and Chief Nolan. I have always had a great deal of admiration for your capacity to do scope analysis on these programs and definitionally determine what is eligible. So I certainly commend you on that. With respect to, as Chief Nolan had identified, the federal funding for COVID, I vividly recall sitting in the room by myself while each of my colleagues, 440 of us right across the province, were advised by Premier Ford at the time that he was holding fast in his negotiations with the federal government, demanding that Ontario get its appropriate share for the costs that we were going to incur for COVID response. And I do certainly commend Premier Ford and the province that were successful in doing so. But that I also sat in that same room with the congratulations on finding this significant allocation from the federal treasury towards COVID response. Now it's time to make sure that that does flow to municipalities. That is there. It is vitally important that we continue to be made whole. Of course, the long-term care at home with the community paramedics was also serving that incredible need when the long-term care sector was restricting admissions because of rampant transmission of COVID. All of these things have put incredible pressures and demands on municipal treasuries. It is now time for us to say to the province that same language that Premier Ford used with the federal government. You need to provide the appropriate level of funding towards the front lines of where so much of this was undertaken. So thank you for those comments. Committee, one further final opportunity on the Treasurer's report. Seeing none, can I have a motion to accept the report of the emergency services? Councillor Emo, seconded by Councillor Murphy. All in favor? That is carried. Thank you. With that, I'm going to invite Mr. Blackmore, if you wish to take us through the long-term care report, and we will approach that the same as we did with the emergency services. We will separate each of the Treasurer's reports for Mr. Foss to present to committee. So take it away, Mr. Blackmore, please.
Thank you, Chair Donahue, and good morning to you and committee members. Through you to committee, the long-term care report starts on page 6. And item number 1 is the COVID-19 pandemic update. To say that circumstances are fluid where long-term care and COVID are concerned would be an understatement. As Bonnechere Manor is once again back in outbreak as of Friday as a result of 2 positive residents. Miramichi Lodge remains free from outbreak restrictions, and we do continue to experience significant challenges with regard to staffing concerning staff who are high-risk contacts or indeed positive with COVID. The next item up is an update to the $5,000 retention incentive for registered nurses. We have since received guidance documents identifying 2 payments for the period of Feb 13 to March 19th to be paid sometime in May, and a March 20th to April 22nd period to be anticipated to be paid in September. The following notice overviews the newly announced Pandemic and Preparedness Act. The Act includes various recruitment and retention initiatives aimed at underserved communities, as well as bolstering clinical education in support of enhanced hands-on learning. There is also an emphasis on the creation and maintenance of and accountability for emergency plans that will be subject to public review. And there's also a component that that addresses the PPE limitations that we experienced early on in the pandemic by way of investing in manufacturing capacities for PPE within Ontario. Item number 2 points out the Health Standards Organization that's currently engaged in cross-country communications with long-term care organizations towards establishing a national long-term care service standard. And this is a bit of a first as far as I can tell in that. I mean, long-term care has long been absent from the Canada Health Act, so it's an attempt to establish a national standard, which in my opinion is a great thing. So this is underway, and Advantage Ontario has submitted a report to the HSO on behalf of nonprofit homes in Ontario. Item number 3 represents significant change to the Long-Term Care Homes Act. Essentially, it's a new act, the Fixing Long-Term Care Act, taking the place of the Long-Term Care Homes Act of 2007. And it's come upon us rather quickly in that it's come into force as of April the 11th. You know, the timing is a little, I would say, a bit off given all that's going on in long-term care at present, with many homes struggling to maintain daily operations, but nevertheless, the act is here, and yeah, so needless to say, there'll be considerable work going forward to make sure that we're up to date with the latest regulations. So a number of the highlights that the Act covers is it's taking the approach of enhancement of resident quality of life by redefining what resident rights are, and a big component of that is the involvement and access to caregiver support. And as committee will recall, we've mentioned before that long-term care is about to be receiving significant funding to get us to the point of achieving 4 hours of resident care. So that's been built into the Act as well, targeting a average of 4 hours of resident care by March 2025, and a target average of 36 minutes of allied health care, and the allied health care being that components for things such as physiotherapy, dietary, social worker, as has been the case for both Miramichi Lodge and Bonnechere Manor. That's the route we chose, was to engage social work. So we're looking at having to increase those minutes of that type of care by 36 by March 2023. And of course, on the heels of, or being in the midst of a pandemic, there's a significant emphasis on infection prevention and control measure improvements built within the Act. As I'd mentioned, caregiver access, I think that's something that came to the forefront with regard to restricting visitor and access during periods of outbreak. has received quite a bit of attention, so that's more emphasis on ensuring access for caregivers to the homes. Quality improvement, quality care. I mean, it's been long-standing in long-term care that there's been an emphasis on quality of care, but even more so now. Specifically with a focus on, this is welcome, a focus on quality of life versus the previous quality improvements. There was a tendency to focus on a lot of clinical type statistics, such as number of falls and these types of things, which are very important, but an emphasis on the resident quality of life with regard to social engagement and these types of things is welcome. So we're going to see more on that. Our medical directors will receive more defined roles and expectations within the Act. And palliative care, there's a real focus on palliative care being built into considerations for care planning, and with the recognition that palliative care, as many people equate palliative care to be that associated with end of life, and that's not the case. It's a continuum. So there's opportunity for palliative care planning to be engaged much earlier in the care planning process, and the Act will be looking at that as an emphasis as well. Item number 4, as I mentioned, is it's just an update with regard to the hours of care being increased for direct care, and direct care being equated to RN, RPN, and PSW hours, as well as allied health, and just some clarity. That it was initially announced that the goal was to achieve 4 hours of resident care per day. The assumption was that would be for each individual home, but since been clarified that the expectation is that the provincial average will raise to 4 hours of resident care per day. But it's also the understanding that, of course, if there's an average, there are going to be homes that are over and homes that are under, and according to that definition, a home that is under, it would be okay to be so, but the ministry did indicate that there is an expectation for homes to demonstrate an increase. So what that means exactly is, or when do you get your finger slapped for not being at what level, I'm not quite sure yet, but it's a provincial average of 4 hours per resident care that is the target. And just with regard to funding, initial announcements, the way it was laid out, it was announced that you would get X number of dollars for this particular period and X for the next period, and there was an assumption that might be cumulative. That's not the case. It's indeed the funding that is announced for that year is for that year, and the funding that's announced for the next year is for the next year. It's not added on. And item number 5, and Jeff's going to give us an overview, but I'll be able to skip to number 6. And item number 6 is details tangible capital assets that were unbudgeted for 2022. In that, what we have here is a couple of file servers that were required for both homes. And in addition to that, we were able to take advantage of IPAC funding to secure some additional equipment, that being the roadside sign for Miramichi Lodge and dishwashers, I believe, ×3. Item number 7, if the committee will indulge me, I'll give a brief overview of our 2021 operational plan, the achievements for the year, as well as what we're anticipating to achieve for 2022. So obviously, daily operations were a handful in even of itself in 2021, with staffing challenges and of course, caring for our residents at various periods of time that were affected with COVID. So that was most definitely the priority for the year, but we did manage to achieve some other things too. So firstly, so one thing we identified early on was, because obviously we're in COVID the year before, so we thought, what is it we can do to ensure that our residents and staff are thriving in this environment as best we can? So we engaged in a number of incentives to bolster visits for our residents, whether in periods of outbreak, whether that be virtually or window or in-person visits, outside visits, in those times when visits were impossible, really beefing up our social engagement with our recreation and department. And in addition to that, keeping our staff morale up. So we engaged in a number of different events throughout the year to engage our staff with thank yous, and whether it be pizza days or subs or prize incentives, opportunities to pat each other on the back and give each other kudos. So we made a conscious effort to do that through the year, and we'll continue to do it through this year. IPAC certification, so we decided we would like to see more of our registered staff become certified, and we did achieve that as well, with a number of nurses and managers being certified through the Queen's University program. And we wanted to have better access to our medical records for our residents, those records that are kept off-site. So we, for a select number of individuals with access, we were able to establish access to what's called clinical viewer for that purpose. Sorry, I should have mentioned our strategic plan is broken into 3 pillars. The first being that of innovation and quality improvement, for which the ones I just mentioned were from that pillar. And under the pillar of safe and healthy workplace, our goal was to continue, and this has been ongoing, to attract and retain the best people. So we looked at streamlining our recruiting and our retention and recruiting process. Basically, essentially, we're trying to narrow down the time from posting to first day at work. And a number of things were put in place to help streamline that process. And in addition, we engaged opportunity through Algonquin College to engage students by way of a living classroom at Bonnechere Manor, and where the students participate in the classroom at the Manor, and at the end of the day, once graduated, a good number of them remained were hired on. In addition to that, we engaged in what's called the Job Out program. So essentially, we used the new resident aid classification to allow a PSW student to basically get paid as a resident aid and acquire their clinical hours toward their graduation as well. So that went over very well too. And under the third strategic pillar of collaboration, we decided to say we're going to do a joint RFP for our pharmacy services. So that was initiated in 2021 and completed just recently. For 2022 going forward, again, we're still under that innovation and quality improvement. We're still looking at keep looking at ways to keep our staff motivated and show our appreciation at every opportunity that we can, and continuing to find ways to meaningfully engage residents and family during these outbreak periods. Further to the IPAC certification, through the Allied Health supplemental funding, we're able to hire an infection control nurse, one for each home. We have the Butterfly project. It's still on our radar for 2022. It's been a bit of we've been in a holding pattern, but I've been in constant communication with Meaningful Care Matters, just keeping them updated for the time being. But we're hoping that we can get to the point where we have a greater number of our staff back so that we can start with the training components. So anyway, it's still on our radar for this year. And also for this year is planning for joint accreditation. So as a first, we've identified through Accreditation Canada, both Miramichi Lodge and Miramichi Lodge as a single entity. So we'll be doing a joint accreditation for 2023, and the planning phases, early orientation phases are underway right now for that. And under Safe and Healthy Workplace, again, continuation with the Job Out program for our PSWs. We're actively recruiting with Of course, with this announcement for additional 4 hours of resident of frontline care, the recruitment, as Jeff can attest to, his department has been fast and furious. Yeah, so we've got a little bit of ways to go to fill our new schedules with the additional hours. And as Ed mentioned, it was a carryover from 2021. It was the pharmacy services. So as of April 1st, Medisystem, who had been a long-standing provider for Miramichi Lodge, at least for the past 5.5 years, is now also the provider for Wondershire Manor. As of April 1, we've done the rollover, staff orientation, all the equipment's in place, engagement with families, and we're just entering into our first billing cycle in the upcoming month. We're still working toward, as a goal, aligning policies for both homes to achieve consistency that way. And that'll be particularly important with the new regs that are coming down with the Fixing Long-Term Care, Ontario Long-Term Care Act. So that's 2021, 2022 operational, just a summary as to what we're at.
Thank you, Mr. Blackmore. That's all of the information items. I think perhaps before we move to resolutions, we'll go back and review, as we had done with the emergency services report, review the information items, and we'll go right through to item number 7, and then we'll reverse and go back to invite Mr. Foss to take us through the treasurer's reports. So with that, committee, we're going to go back to page 6 of your reports, information items, and information item number 1, COVID-19 pandemic update. As Mr. Blackmore had noted, this update, we cannot keep pace, actually. I know that it is an incredibly dynamic environment at both homes, and it has been a seesaw affair right through 2022. Any questions or comments on item number 1? Warden Robinson.
Thank you very much, Chair. Just about the co-payment waiver program, more of a comment than anything. I hate to see the fact that people who need care do not get to go and for their first choice home. That just doesn't sit very well with me. And of course, then I'm thinking if we had more funding in our long-term care community paramedic program, could these folks actually go home and get the support they need? So again, it's just very unfortunate that people have to live where they do not want to live.
Thank you, Warden Robinson. That didn't sound so much like a question as a comment, I'm presuming.
There was no question at all. It was a comment.
Thank you. Anything further on item number 1? Seeing none. Moving on to item number 2, the National Long-Term Care Services Standard. And item number 3, the Fixing Long-Term Care Act 2021. Councillor Murphy.
It is taking some getting used to being back in the chambers. Thank you, Mr. Chair. Through you to Mr. Blackmore. Were you consulted at all? Were any of the long-term care homes consulted? And were you given a long enough time frame for proper consultation, or was this just thrust upon you at the worst possible bloody time in probably long-term care history to be changing policy, and I'm assuming some of these will be quite onerous on your staff. So I'm just wondering if you could give and knowing that, I mean, it came into effect 2 days ago, I'm just wondering how that's affecting your department. Thank you.
Mr. Blackmore, please.
Through Chair to Mayor Murphy. There was a consultation period. It was brief. I'm guessing it's less than a year. It's months. And Advantage Ontario had solicited, feedback. But by comparison, when you look at the Long-Term Care Homes Act of 2007, I think it took until 2011 to come into force, like a period of almost 4 years. And here we are. This is all within a year, and all within a tumultuous year, like a busy year, a year short-staffed. So, I mean, there are things in the act that the framework already exists, and they're like, it's a tune-up essentially. And there are some items that give leeway, like you have 3 months, 6 months to implement, and there are others that are. I think the quality improvement piece, you have maybe whatever it is, let's say 6 months, a year to submit, but in the meantime, you're still expected to submit an interim, which is equal to work with, So yeah, I mean, it's the timing is not good, but like I say, there are some things in there that the framework does exist, and it's a matter of tweaking. There are things that are entirely new.
Thank you, Mr. Blackmore. I think that I guess wave one, I'm kind of lost track of waves. Everyone is referring to this as wave 6, but in wave 1, it was felt most acutely within the long-term care sector, and that has stayed with us. And certainly what it did is, for the broader public, I guess, shone a very bright spotlight on a number of issues that those of us that have been involved in the long-term care sector for a number of years were very well aware of, and had certainly been advocating, but there had not been a great deal of traction. So I certainly will commend the province for taking that initiative. It is unfortunate tendency, it seems, of us human folk, that it is only when absolutely compelled to do something or take some action that we do so. So I certainly have to express gratitude that it is being done. I think that it will be something. I certainly am quite hopeful and expecting that it will evolve over some time. I will note, and we'll get there at number 4, so I'm not going to belabor it at this item, but you will note the second bullet point on page 8 with respect to item 3 is once again talking about the system target average of 4 hours care. Keep that in mind as we get to item number 4. Is there anything further on item number 3? Then moving on to item number 4, any questions or comments? The one I did have an opportunity to discuss, to clarify with Mr. Blackmore earlier this week. So there is funding, you'll note there is funding being provided in item number 4 towards this 4 hours of care, this ever elusive aspirational goal. We are trying to summit, if you will, I guess, this 4 hours of care. So it is somewhat disquieting that that we are now understanding that it is a system-wide average of 4 hours of care. I guess my concern is if the system-wide average was in excess, if 4 was the baseline and thou shalt provide nothing less than 4, then it would alleviate any concerns that I may have on this. And once again, certainly commend this provincial government for taking the initiative in moving towards this, but there is an entirely different thing on each long-term care home shall versus the system will have an average. My father was often fond of saying that 1 foot in the oven and 1 foot in the freezer on average made him just completely comfortable. That is not how this needs to be approached. That 4 hours needs to be the basis for each long-term care home. As Mr. Blackmore and I discussed on our own, the funding is being provided. There is an expectation for each home to achieve that 4-hour standard of care, and the funding is being provided. I guess perhaps I can take some solace in that this is setting up the foundation, but I'm hopeful that in fairly short order we will also find out what sort of measures are going to be put in place to ensure that minimum level of 4 hours of care. The average does give me some pause. Anything further, Councillor Murphy?
Mr. Chair, Rose just reminded me that we're a committee of 10, and so we don't actually have quorum right now. Would it be appropriate to maybe take a 5-minute break before we move on?
If I might, I'll verify with Mr. Morrow. We are a committee of 8 outside of the city of Pembroke. Does the city of Pembroke 2 members impact our quorum? We are 5 currently, so if the city does not impact quorum, they are certainly not named in our striking committee report. There are only 8 members named in our striking committee report. Mr. Morrow, if you would mind sharing your comments.
Thank you, Chair. I apologize. It's the group of, it's the back row leadership team. My apologies, Chair. If the striking committee bylaw identifies the composition of the committee, we utilize that to establish quorum. So if you're correct in suggesting that the striking committee bylaw
Sorry,
identifies...
let me clarify, Mr. Morrow. If I'm correct, is that what you said?
Yes. As I'm sure you are correct, Chair, as always, then I would believe we would have quorum, sir.
We do indeed have quorum. Thank you. And thank you just the same, Councillor Murphy, for bringing that to my attention. And Warden Robinson, you are off the hook. You don't need to quietly slip back into the room. This is just like church. All of the wisdom is in the back row. Anything further on item number 4, the 4 hours of care funding? I see none. Moving on to item 6, leaping over item number 5 again. Item number 6, the unbudgeted tangible capital assets that were omitted from the budget process. And finally, item 7, the homes, the long-term care homes 2022 strategic operational plan. Seeing none, Mr. Foss, the floor once again is yours to take us through each of the long-term care reports, please.
Thank you, Chair. Just direct committee's attention to the appendix. The first one, I guess, is Bonnechere Manor. So we'll just go in that same order. And I'd like to direct your attention to the very end of the report, which would have been on page 17. Just giving you a moment to get there. So this particular financial statement presented to you today reflects gross expenditures for Bonnechere Manor of $17,465,000 against total revenues of $17,608,000. That's a $142,000 surplus. But a $142,000 surplus against activity or revenue activity of $17.6 million, so a fraction of 1%. So the margins here are small. But we did wind up in the black at the end of the year, so that's the first bit of news that I want to report to you. Just going up to the top of the revenue section on page 17, municipal subsidy, of course, is determined by this council on an annual basis, and in 2021 we set a COLA target of 2.5%, and we increased the funding coming to Bonnechere Manor by 2.5% over what they received in 2020. And in fact, we flowed all of those dollars to Bonnechere Manor so that the management team had those funds to be able to manage their operations for the year with. So no budget variances in that municipal subsidy. Under resident revenue, of course, we have the basic accommodation as being the co-payment share. The funding formulas in long-term care are essentially a guarantee by the province that they will provide to us a specific level of per diem funding less whatever resident revenues that we receive on an annual basis. And so this basic accommodation should not be looked at in isolation. It is in combination with the provincial subsidy, but very close to what we had expected, about $6,000 more than anticipated. So if the formula was perfect in accordance with our budget, we should get $6,000 less of provincial revenue in order to hit that guaranteed level of funding. Under preferred accommodation, however, we are able to keep all of that preferred accommodation. That's not shared with the province of Ontario. That's kept by the home itself, and so that's what's generating a small surplus or an increased revenue for us in preferred accommodation. The next category of revenues is other revenue, and you'll see interest income at $49,000, just slightly above our target of $45,000. And other revenue is that feed-in tariff revenue for our solar panels. We estimated $123,000 for the year, and the final numbers came in at $117,814, so about $5,000 less than anticipated. Of course, this line item came originally from a proposal that we shared with this committee and all of County Council in order to spend about $600,000 on this solar panel project, and over a 5-year period, we were able to repay that loan, if you will, from our reserves. So on an annual basis, this $117,000 now is used by the home to support all of their activities on a go-forward basis until those solar panels no longer are able to generate feed-in tariff revenue for us. Next to that, we have our grants and subsidies, and you'll see in total we're about $1.7 million ahead of where we anticipated. So we'll talk to you a little bit about where that came from. The top line item under nursing and personal care, we had a CMI-related budget of 0.984, and the actual came in at 0.981, so very, very close, but slightly below our budget, so a bit of a revenue loss under our nursing and personal care envelope. But toward the bottom of that revenue section, you'll see province global level of care subsidy. And when the current provincial government came into power, they really changed, if you will, our funding for long-term care homes, where instead of providing for us an increase in our per diem allotment, they simply froze it and allowed the CMI to adjust that basic per diem factor. But they introduced a brand new level of subsidy for us to really take over, if you will, any inflationary or COLA increase on the per diem funding, and they called it global level of care. In 2020, we received $4.50 per day from this new global level of care funding subsidy, and in April, the province made a decision to increase that to $7.27 per day. So that is the source of our $136,000 additional revenue that came in under our global level of care. Next to that, I want to talk to you a little bit about a bunch of those revenue items that did not have a budget beside them. So the first one is provincial revenue. It's IPAC revenue, or Infection Prevention and Control funding. And with that funding of $205,000, we spent $78,000 on staffing costs related to IPAC activities, training of $31,677. We spent $71,053 on minor capital and $24,667 on other equipment items. I have chairs listed here. The big one, of course, though, is one-time funding for COVID, $1,367,000. We had incremental salary and benefit costs throughout all of the departments. Again, our payroll system is collecting anything identified as increased staffing or sick costs related to COVID, so people who are on isolation or actually physically sick because of COVID, or any overtime costs that are incurred because of a short staffing situation because of COVID. So in total, $416,000 worth of salary and benefit costs related to COVID. Our PSWs, and this committee is aware of the fact that the province announced on multiple occasions a $3 per hour increase in the hourly rate to our PSW staff. They seem to make multiple announcements, Mike. I don't know, throughout the year, every 3 months, they would decide to extend and extend and extend. And so in total, $440,744 in incremental hourly rate increases were provided to our PSW staff. We had direct COVID expenditures, COVID-related expenditures of $286,000. We spent $39,000 on minor capital items, and finally, our testing and screening activities at the door, $184,004. In total, provincial subsidies of $1,367,000 related to COVID activities. At the very bottom, you'll see federal ICIP funding. This committee will recall that we did make an application to this program for our new HVAC system at Bonnechere Manor. That was approved at $990,000 in total. In 2021, we spent only $13,000 for engineering work by Good Key Weedmark for this new HVAC system, so the bulk of that activity will now take place in 2022. I would be remiss not to talk a little bit about, again, our WSIB actuarial review. In total, we had increased actuarial liabilities for Bonnechere Manor at $979,000. Luckily, that was offset almost entirely once by salary and benefit costs being under budget on our base program. So if you looked at all of the salary and benefit accounts and you removed all of the COVID-related subsidies or activities that were related to COVID, our base staffing levels were $797,000 below budget. So almost all of that increased WSIB costs were offset by staffing challenges, I guess, if you will, at Bonnechere Manor. I think my colleague, Mr. Blackmore, can certainly agree with the fact that it has been very difficult to be fully staffed at Bonnechere Manor throughout 2021, and that is reflected in that particular position. On a final note, the item before this in your agenda was that increase of funding by the province to get us to 4 hours of care per resident per day, and as Mike indicated, that is potentially on a system-wide basis, but they did cash flow us some money. $216,000 for direct care and $41,000 for allied professionals, so about $250,000 came our way. We were not able to use any of that money. Of course, as I mentioned, we were very, very challenged just being able to meet our 2021 staffing budget as it was, so no opportunity to increase those hours above our regular program in order to start to move toward that 4 hours of resident care per day. The HR department is constantly busy in attempting to recruit direct care and allied health professionals into both of our homes. So that will be a focus for us on 2022. We do not want to ever see provincial subsidies go without being responded to, but that is certainly a challenge for us in Renfrew County to find those particular staff. And Mr. Chair, maybe before I move on to Miramichi Lodge, I'd be happy to answer some questions on Bonnechere Manor.
Thank you, Mr. Foss. At an appropriate pause, I would invite now from committee any questions, comments on the Treasurer's report on the year-end for Bonnechere Manor. I think it's probably safe to say, Mr. Blackmore, that as a mitigation measure against the WSIB, staffing challenges is probably our preferred mitigation measure. With respect to I do see you now, sneaking up on my right. With respect to the revenues, there was one line, and I'd inquired of Mr. Blackmore. Bear with me, just apologies. I'm going to get back to the revenues. The basic revenue recovery item, I see that it seems to have a different naming convention with the lodge and with the manor. I'm presuming it was the same thing. Here it is showing a negative revenue of 67,000 on the lodge. It's in excess of 500. It's just under 510. I wonder if you could speak to that, Mr. Voss.
Thank you, Chair. So the province, was definitely scrambling this year with various funding programs, if you will, and attempting to reconcile some of the cash flows that they were sending us to some of the quarterly and mid-year reporting that homes were doing. And based on that, and the reason for a brand new account being set up in our financial statements is they cash flowed to us in Miramichi Lodge an amount of $506,000, and that wasn't part of their regular cash flow. And in Bonnechere Manor, they had an adjustment, a credit of $67,000, a one-time adjustment related to a difference between previous cash flows and our occupancy reports that we file with the ministry. And not to worry, we accounted for all of these items when we calculated what the provincial subsidy should be for both of our homes, and we are satisfied that consider this to be part of our base per diem funding that comes to our homes, which is CMI adjusted for nursing and personal care. But we have reconciled all of these payments and simply allowed this to stay in an account by itself because of the unusual nature of the cash flow transaction that came to us. We were watching this very closely throughout the year, but when I calculated year-end subsidy for both of the homes, I took this line item into account, and so we don't have a payable or a receivable for this line item. So no really concerns for us. The bottom line for Miramichi Lodge and for Bonnechere Manor account for these transfers. Thank you.
Thank you, Mr. Voss. Madam Warden, I believe you had a question.
Thank you very much, Chair. Not a question. I'm going to make another comment. There was a lot of advocacy put into the 4 hours of care by, certainly local municipalities as well as the EOWC, Roma, and AMO. We have that, but now we don't have the human resources to fulfill that obligation. So that is certainly the East Ontario Wardens Caucus. One of their 3 priorities this year is healthcare, human resources. It's certainly a topic that is also on the agenda of the Health Task Force for AMO that I have the privilege of sitting on. So it is a challenge across the area, and I just think the message really has to be to our residents that we are trying everything possible in order to fulfill that obligation, because we know it is desperately needed. So, Mike, I appreciate your staff doing everything they can, but they're not superhuman, even though they seem to have been that in the past couple of years. And going forward, I just think as a county council, we have to be very supportive of any efforts at all that are, maybe it has to be innovative thinking as opposed to the regular recruitment sort of process to find the people that we need. Thank you.
Thank you, Madam Warden. And certainly that is going to be a significant challenge in working towards that desired goal of the 4 hours. And keep in mind, too, that it's all those that have been advocating for that for probably 20 years. I'm not sure if it started with Shirley Sharkey in 2006, but certainly it was prominent in the report that she had delivered to the Minister of Health at that time. Certainly, do have to speak to, it was an item within number 1 of the report. These, I think, are perhaps the first steps, but the learn and stay to make permanent the enhanced wage for PSW, et cetera, I think that these are good first steps in recognizing that challenge in meeting that 4-hour standards. It's going to take a great deal of heavy lifting, but at least I am somewhat encouraged that those first initial steps have been taken. Follow up, Madam Warden.
Thank you. It just occurred to me as well yesterday during the Development and Property Committee meeting. We were told of recruitment fairs that have been happening involving immigration, the immigration partnership, and the opportunities there, and certainly healthcare was one of the main focuses of our staff, trying to speak to people who may be interested in the healthcare field. So really is all hands on deck here to try to do the best we can for our residents.
Thank you very much. Absolutely worth noting. Every avenue that's available to us has to be fully exploited. Anything further on the matter? Just the final, and again, it is very similar to the Emergency Services report, Mr. Foss, Treasurer's report. I'm assuming again that it is within the benefits line items distributed throughout the various categories of departments within the manor. We are seeing that, in fact, I have open in front of me right now nursing services, where in fact the salaries are 1% under budget, while benefits are 53% over budget. So once again, I'm assuming that is the line item to which that substantial charge for WSIB liability is housed.
Yeah, thank you, Chair. You are correct. In our employee benefit line items, WSIB is one of those components, like CPP and EI and EHD and all those other items as employee benefit costs. So WSIB is in there as well, and distributed throughout the departments, $979,325.99 over and above what we expected it to be, and as a direct result of the actuarial study.
Thank you, and so I thought that that's what it was, and I just want to kind of circle back in the midst of that extra $975,000 unanticipated charge for WSIB, there was still a surplus of 142. So, but for that substantial liability that was brought to our attention through the review by the actuarial, we would have established a surplus of somewhat in excess, I presume, of $1 million on otherwise from that WSIB charge. If there's nothing further, then let's move on to the lodge, please.
Thank you, Chair. And similarly, I would ask committee to just go to the very last page of the Miramichi Lodge financial statement, which is page 22. And on page 22, the margins are even slimmer within Miramichi Lodge. We have a municipal surplus being reflected, or a budget surplus being reflected, of $24,309 against revenue of $16,827,000. So we are in the black, but we are once again barely in the black for Miramichi Lodge. Likewise, the very top line item, municipal subsidy, like Bonnechere Manor, we've increased that from last year by 2.5% and transferred all of that money to Miramichi Lodge for them to be able to manage this particular program. Within the revenue residence section, again, preferred accommodation, those dollars are bottom line. We get to hang on to those, and they're not offset by any other provincial subsidy calculations. So that's always good news for us any year that we see any increase in preferred accommodation. Interest income came in at $30,775 against a budget of $30,000, so essentially right on in that particular area. When I get down to grants and subsidies, again, like Bonnechere Manor, $1.5 million more than we anticipated. And what's really driving that, of course, is COVID at $1,212,000. So in this line item, we supported salaries and benefits directly related to COVID through our payroll tracking system of $262,944. The PSW wage enhancement, the $3 an hour wage enhancement, $443,874. We had direct expenditures in each of the departments. Anytime you see an account labeled as COVID, those are accounts payable purchases that we make for supply items, PP&E, or whatever the case may be throughout the entire group of departments. $255,000 of expenses. We offset $95,096 in small equipment items through this COVID fund. And finally, testing and screening, $155,716. So in total, we were able to utilize $1,212,000 of COVID-related support. Similar to, again, Bonnechere Manor, we did apply to the ICIP program. That federal program, that was for an HVAC project. We are approved for a total $106,000. And in 2021, we had Howard Engineering beginning some of the work to design what needs to happen at Miramichi Lodge within this $100,000 program. So the bulk of that that activity will happen in 2022. And just below the ICIP account, you'll see $89,755 in IPAC revenues. We supported staffing costs directly related to IPAC activities of $61,248 and $28,507 in training activities. So for Miramichi Lodge, we also had a actuarial adjustment, an increase in actuarial liabilities overall of $336,000, but total salary and benefit costs for the entire program, excluding COVID-related activities, we were under budget by just about $200,000. So most of that WSIB increase was offset by being short-staffed within Miramichi Lodge by $189,000. Nowhere near the situation that's happening in Bonnechere Manor, so almost fully staffed in Miramichi Lodge for the entire year. Similarly, we had that funding provided to us, just really began November the 1st, only the last 2 months of the year, to get us to that 4 hours of resident care per day on average. For Miramichi Lodge, about $240,000 in total over those 2 months, and we were not able to utilize that funding level. Again, being under budget on our base program, we're not quite able to support or to recruit or to maintain staffing at our base level of funding. So not able to tap into that additional subsidies. Again, will be a focus in 2022 to be able to recruit and move toward that new higher level of care and utilize those subsidies available to us. And perhaps with that, Mr. Chair, I'd just be open to questions.
Thank you once again, Mr. Voss. I will open it, committee, to any questions or comments with respect to the Treasurer's year-end report for Miramichi Lodge. Mr. Blackmore.
Thank you, Chair Donahue. If I could, through to committee, just a bit of an update with regard to recruiting efforts so far this year. We have seen added hours at both Miramichi Lodge and Bonnechere Manor, and a significant uptake in full-time positions at the Manor, and a new schedule with additional hours that's already underway at Miramichi Lodge as well.
Thank you. Very pleased to hear that update, Mr. Blackmore. With that, then, I'm going to return, just bear with me one moment, to my agenda. And we left off, I believe, at item number 8. So if you would be so kind as to take us through the resolution, Mr. Blackmore. Committee can find that on page 11.
Thank you, Chair Donahue. Through you to committee. Item number 8 seeks a resolution for the Warden's authorization for the signing of a declaration of compliance with the multi-sector service agreement for Bonnechere Manor Adult Day Program. Shall I read the recommendation?
Please do.
A recommendation that the Health Committee recommend that that County Council authorize the Warden and Chief Administrative Officer Clerk to sign the Schedule F Declaration of Compliance for the period of April 1, 2021 to March 31, 2022 as part of the Multi-Sector Service Accountability Agreement, amending agreement between Ontario Health and Bonnechere Manor Senior Adult Day Program for the continuation of 100% funding.
Thank you, Mr. Blackmore. Can I have a mover, please? Councillor Murphy, seconded by Councillor Grills. Back to you, Mr. Blackmore, for the background.
Thank you, Chair. Through you to committee. In the background, Bonnechere Manor has been operating a senior adult day program in Renfrew since February 1997. The program is available to residents in and around the communities Monday to Friday from 8 a.m. to 4 p.m. Access into the day program is through the Home and Community Care Support Services. For the continuation of 100% funding for the Bonnechere Manor Senior Adult Day Program, Ontario Health is requesting the signed Schedule F Declaration of Compliance for the period of April 1, 2021 to March 31, 2022, as attached as Appendix Long-Term Care 2.
Thank you very much. Committee, any questions, comments on the resolution? All in favor? That is carried. Thank you. And while we're at it, I would seek a resolution to adopt the long-term care report, please. Councillor Bennett, seconded by Councillor Emo. Further and final opportunity for any question on the report as a whole. Seeing none, all in favor? That is carried. Thank you. You will note attached on page 25 or included on page 25 are the Board of Health minutes for the Board of Health meeting of February 22nd, 2022. I would endeavor to answer should there be any questions or comments on those Board of Health minutes. I'm seeing none. Can I have a motion to receive, I believe, the Board of Health minutes? Councillor Grills, seconded. Councillor Emo, you're the lucky winner. All in favor? That is carried. Thank you. Is there any new business? I see none. Mr. Morrow, there was no closed meeting at the time of mailing. Has that changed? It has not. Thank you. The date of the next meeting will be Wednesday, May the 11th, 2022. I would now seek a resolution to adjourn, please. Councillor Bennett, second. Councillor Murphy, all in favor? That is carried. Thank you. We are adjourned.